Cryptic pregnancy is actually a medical condition whereby someone is not aware that she's pregnant. For instance, someone she might be having pregnancy symptoms, the tummy will be growing, but there is no baby in there. Okay, and she's not really aware that she's pregnant, except when the during advanced stage of the pregnancy, maybe when the tummy has started coming out and all that. But usually there is no baby there. That is why it's called cryptic pregnancy. But the reverse is the case when it comes to Nigeria. Okay, people now use this medical condition, which is in existence, to be defrauding people, especially those that are so desperate to have a child. When you see a mother that is someone that is married and she's unable to give her husband a child, or maybe she has a lot of girls and was finding it difficult to give birth to a male child. We all know the male child preference and what having a male baby or not having a male baby entails in marriages. Okay, so these women, they now fall victim most times with these gullible healthcare professionals, because those that are into this thing, they are mostly healthcare professionals, doctors, nurses, midwives. Okay, so what they usually do, they will try as much as possible to inject these women with hormonal drugs. That's estrogen mainly, and then at times they will use progesterone. So what this hormones does is that it makes that woman to start having symptoms of pregnancy. She will start having early morning sickness, her tummy will be growing, but there's no baby inside that place. There is no baby. So they will now be, checking the time she will be 9 months due, and she will look out for CS. You sef, they will even advise those women not to go for ultrasound scan, like not to go for ultrasound check in other hospitals, because when they go there, that they will not be able to see the baby. Some will even go to the extent of telling them that the baby is hidden in the liver, that the ultrasound scan cannot show that baby, cannot reveal the baby. That is the lies they will tell them. Let me tell you, when someone is pregnant, the scan will detect it. If it's just a particular hospital that is detecting your child, just know that something is super duper fishy about that pregnancy. So what they now do towards the end of pregnancy, towards 9 months, they will book the woman for CS, because they have an agenda. They know what they want to do. They book the woman for CS, and during that CS, they will anesthetize, okay, so that that patient will not be aware of what is going on. They will give general anesthesia, so that when the woman now wakes up, she will see a baby by her side. The fraud there is that that mother lying there